Hey guys, welcome to another episode of the Best Practices Show podcast. My name is Kirk Barron and I am your host, and I am so grateful for you showing up. Thank you so much for showing up. You are listening to the number one podcast for the best thinking, tools, tips, advice on how to build a better practice and a better life. And we couldn't be more excited that you're here. And I have a great guest today that you're absolutely going to love, who I have gotten to know recently, and he's a brilliant educator, Dr. Scott Maclean. And we're going to be talking about something that's very hot and exciting in dentistry. We're going to be talking about the future of surgery, guided surgery, and dynamic surgery. If you don't know what that is, you're going to love this and how AI plays a role in that. So stick around, do us a favor, grab a pen and hit the share button. You are absolutely going to love this. Now, one thing, if you're here for the first time, number one, I want to just welcome you for showing up, because I just want to welcome you to a community where we have one goal here. It's to never stop learning. So we're going to bring the best KOLs in dentistry, the best thought leaders, best teachers, just to bring you great information. So make sure you subscribe wherever you listen to podcasts, whether it be on, Apple, iTunes, Google Play, Stitcher, all of those. So you can get a great new episode every week. You'll see we'll be here every single week, bringing you brand new, great information to help you and your team create a better practice. Also, we take great show notes here. So after the show's over, I'm going to encourage you to come back and visit where you'll see all the notes and you'll see everything that Scott and I talk about. We'll list a link for it. You're going to see a link to his YouTube page, which I'm going to highly suggest you subscribe to. It's brilliant. His Instagram is off the charts. Very cool. And if you're looking for an awesome speaker to your study club, this guy is your guy. And number one, not only is he an incredible educator, but he's a great guy. So just check it out. So I want to introduce my guest today. Scott, you and I, like we were talking about before we went live on this, I didn't really even know you. You've been, and I also want to talk about where we met. I want people to know who Dr. Scott Maclean is. So let's start there. And then you and I can talk about how we met and how we got to know each other just in the last couple of months. So who's Dr. Scott Maclean?
Oh, that's a good question. Thanks for inviting me here, by the way. It's great to see you and to chat with you. But who is Scott Maclean? I would say a passionate dentist that loves to teach, loves to learn. I've been involved with a lot of things. I come from a small place, so I come from Nova Scotia. And so one of the things was, how do I get to be a speaker like internationally? And last year I was in Spain and Australia speaking, and London, England, and all over the States, almost in every state. And it's about getting myself out on the internet and learning and teaching and doing a lot of video stuff. And so I'll share that, when I go online. But Scott Maclean is probably, I'm more of a giver than a taker. I love to kind of, mingle with people and understand what's happening in the future. I love artificial intelligence. I love to see what's going on in digital dentistry too. So that's kind of where I am right now, Kirk. And, I still love practicing. I just finished a busy day and I have another half day tomorrow. And we do a lot of dental implants in our office and a lot of cosmetics, full mouth reconstructions. And so by doing that, I found it very, very informative to kind of get information from the best people in the world, and also to share what I know, so that along the way, I like to think that I, learned a lot of things and I'm able to put that out there. So anyway, that's kind of what I'm up to right now. So
yeah,
three children, and, very successful children, and so we're having fun.
Yeah, you are very much a giver, and it was so cool. You and I were mutually introduced by a good friend of ours, Dr. Michael Cohen from the Seattle Study Club. Now, I want to say this: if somebody's listening or watching for the first time and you don't know what the Seattle Study Club is, and Scott, you've done a lot of work speaking for them, and the Symposium is coming up. If you've never had a chance to check out Symposium or see the Seattle Study Club on January 29th and 31st, it's going to be your opportunity to get involved, and it will be virtual, which is sad because that's usually the one meeting of the year I do the most hugging. My wife went for the first, she's been going for years, but she's like, you hug so many people there. I'm like, It's not about the education, it's about the information. But can you talk about what it is? What is the Seattle Study Club? You've been doing a lot of work for them for years. How special is it?
It's one of my most favorite places to attend. And, certainly Michael Cohen was introduced to myself quite a few years ago. And I thought, this guy has something different, and his team as well. You're going to see some of the best speakers in the world at this event. You know, there's going to be little snippets of it. My picture's in there somewhere, but
you're on the program. Look at that.
Very honest. Oh yeah, there I am there. So anyway, it's going to be very, very interactive. It's really, I give my hat goes off to Michael Cohen, because I think this is going to be probably one of the best symposiums online. And what I think it's going to happen is that you're going to have a lot of new members join, because they're going to see the benefit of doing this type of dentistry. So you're having everyone from team members being orthodontists and periodontists and oral surgeons and prosthodontists and you know, all kinds of different people coming together to share their knowledge, and even pharmacists and people talking about all different avenues, how you live healthier, how you get your brain to live healthier, you know, and how you as a person can really grow. So I would encourage you to check this out and see the speakers that are involved, because it is a very valuable resource for dentistry. And I've learned so much from this group, and I think that it's a group that we meet locally. So you would find a local group that you can join. So you just have to go to seattlestudyclub.com, and the information is there. You can download that, but then find someone that you can, it's about mentorship really. And mentorship is a two-way thing. It's about giving and taking. And so, you know, more about giving almost. And so we sat around many times talking about just about COVID things, to, you know, how to do impressions better, to how you make implants, get in the right position, to all kinds of different things. Even, you know, how do I take better care of myself? How do I interact with my team? And the things that Kirk has to offer. There's so much stuff that's out there. But this, if you look at the speakers here, you're going to see a lot of very skilled people. And usually Michael Cohen will put this out so that it's little snippets that you can go to one or the other. So you can really choose your avenue, but it's not just about one thing. And that's the beauty of it.
Yeah,
So
I love how it's not. Now, two things. Number one, you have your own Seattle Study Club, right?
That's right. Yeah.
Yeah. And this isn't just about dental education. This is a well-rounded program. I mean, you've got Bale and Doneen, and you've got, you know, customer service trainers, you've got psychologists. Like, it's a well-rounded life practice clinical program, more than just dentistry, right?
Absolutely. And the thing is, there's sometimes you listen to it and you go, wow, I've never thought of that. I need to get into that more. I need to learn more about that. And whether it be sleep apnea experts to people talking about, you know, how to do, you know, full mouth dentistry when you have advanced wear techniques, or, you know, Sonia Laissez in terms of another Canadian. I love listening to her. She's always talking about some of the downfalls. Like, people put it out there that you're seeing the problems and also the good and the bad. And so that's really important. You learn a lot from some of the things that you can share. And so I've really enjoyed being part of this group. So when you say I have my own club, what we are is a small club in Nova Scotia that has dentists that meet monthly, and we go over topics and learn different things. So Kirk will be coming to our club to talk, and so different people will talk about different topics. And so the club itself has a director. So I'm a director, and then there's different people on the board kind of that help with the club, and we have people kind of working together. So it generally attracts advanced dentists, or people who want to be advanced. And I'm proud of my dentists that are in the group. We talk from everything about how to work with your children to how to be doing better dentistry. So it's really interesting.
Yeah, it's such an important piece. And that's really where the magic happens, is in the club with those conversations. There's no such thing as a successful hermit. You know, you need the help of everybody else. And you know, the treatment, you know, it teaches you how to think too. The treatment planning component is tremendous. And you're right. I mean, there's so many things you said that resonated with me, but one of my favorite things is every time I go there, I'm challenged to think a little bit farther, from the futurists to the treatment planners to how they communicate. Even the treatment planning process is like so powerful just to see great people think at a much higher level. And today we're going to be talking about this, and we've got an awesome topic. Now I'm just going to say this because you're my friend. You came on, we met you at the COVID conference, you became a host. And every time we had you present, I was like, holy moly, this is so high level. You even extracted your own tooth on an iPhone camera, or you can probably describe that. But what I'm trying to say here is this guy he gives you a perspective that is so awesome. And I don't even know how you do this. And today we're going to be talking about the future of guided surgery and a little bit about AI. But let's talk first about why this topic. I love the why before the how. So why is the future of guided surgery so important?
I think it's about many years ago, I was doing a presentation in Chicago. And so I was doing a presentation for 350 dental lab technicians. And I asked the question was asked, how often do we have the implant in the right spot? And so they had little kind of iPhone, kind of ways for them to answer the question without anybody knowing. And so when the 350 people voted, we were hitting, about, 50 to 60% that the implant's in the right spot. And I was going, come on, that's just crazy. Like if you were, a batter and you were doing that, that's pretty good. But as a dentist, we want to get this in the right spot for long term. And so I've been involved with it for quite a while because I love digital. And so I just thought, okay, anything digital that I can do, it's helping my practice. So anything from using my iPhone to do a lot of video work, and I do editing, and we've done courses on how to use your iPhone in your practice, and it's very powerful. I can generate a video and have it so that it's ready and worthy to go on the internet pretty quick. And I have team members that shoot it for me, and we're using the iPhone. I used to have big cameras, and we're using the iPhone. But this digital world that we're talking about, I found that patients want that. They understand a GPS in a car when you're driving. Who would open a map now and then put the map and then drive through a city that they don't know? Well, every patient's like a city we don't know. Yes, they have like a center tower. They have, where the mayor lives and all that kind of stuff, and the streets leading to the bridges. But there's basic structure, just like you have nerves and you have jawbones, you have different things, but each is very individual. And our goal is to try to understand the principles of healing of the body. So, I like Tom Linkovicius's book, Principles of How Implants Work Well. And that's really a great book, by the way. But when you go to do this, you want to get the implants in a position so that's going to be long-term, because otherwise the patients are coming back and they're having problems. And so our goal is to do that. So guided surgery to me meant that I'm taking it and linking my brain to my hand. So that link is done through guided surgery. So if I look at the map and then put the map down, then that's like the old way of doing it. And to me, that's like using old internet, dial up and all that. I grew up on all that stuff. So by using guided surgery, I'm able to get the plan done and then take it to the patient's mouth and then transfer the plan into the patient's mouth, whether it's dynamic guided, meaning that I'm watching my hand do it, and we'll explain a little bit more about that, or if it's template guided. So template guided means we put something in the patient's mouth and it puts it to the exact depth and angulation to get that implant so that it's going to perform well. But we have to know where it needs to be, how thick the soft tissue should be, where the implant's going to fit between other teeth, nerves, and all that structures, and really deliver that. Because when I first learned about this, Kirk, I learned about implants. It's more than probably 22 years about placing implants. And when I learned, it was like, okay, put it into the bone, the level of the bone. And I quickly realized that that's just not where it should be. And as we went and grew and had new implants develop and had, different systems of platform shifting or switching, and a whole bunch of systems work. And I am a KOL, so I have to be careful. I don't want to promote one implant company, but I do want to promote the values of guided surgery. And the values of guided surgery are across the board. Some are better than others. The system I use, I really like. And I'm sure there's other systems that I don't want to offend other people, but there's really good systems that do it as well. But I do like the fact that I can go either dynamic or I can go static guided.
Right. Okay. So let's go back to that because this is really important. They're guided surgery and dynamic. You said navigation before we. So let's start with a definition of that and what those two paths are and why you choose those two paths.
Okay. In order to understand it, you're kind of understanding it more like a verb than a noun. Okay. So we have to understand what the process is. What are you doing? And then you'll understand what the noun really means, which is the dynamic. So dynamic really means that you're having the patient in, you're doing a scan, and you're able to take that scan and transfer it into a computer program, plan the implant, then take it to another program, which what I'm using is called the X Guide. So in the X Guide, then there's a number of different systems. When you use the X Guide in my hands, then I'll take the plan, transfer it in there, and there's a little clip that goes in the patient's mouth that's been in the mouth during the X-ray. So after this is all done, I can go in with my hands, and I'm watching my hands move on the computer screen. So I can see my hands moving back and forth, the same as if I'm driving my car, and I can see my little car, the same as if I'm in my boat. My favorite part about boating is having the navigation. That's my favorite part. I spent like, I don't know, I don't want to say on here how much money I spent on my little navigation part. But when you navigate, the beauty is you're seeing your hand, you're seeing the implant go in real time. So there's some value to that. And there's also some downfalls for different cases. So that you have to pick your case based on what you're doing. But almost always it will work. And so if you're using one or the other, I think that's the important thing, but there's certain advantages is why I choose one over the other. Now with the other type of guided surgery, what you would do is have the patient in for, say, a new patient exam, or we call it an implant workup. They would take a 3D x-ray, so a CBCT x-ray. They would take also an intraoral scan with a scanning camera. And when you take those two things, you put them together, you have a very powerful way to plan the implants and then have something fit that's going to fit on the intraoral scan. So when you put that into the mouth, it transfers where the implant's going to go. So everything is then guided. And if you want to see how that works, you go on my YouTube under Scott Maclean, you'll see all kinds of different dynamic and also template guided. But both are fantastic, and both take a little bit of different setup. So for us to really understand it, doing the verb, you're actually doing a procedure today. Dynamic means scan, plan, and then navigate right away. So within an hour, you can get it done.
Yeah, you said you can scan and do surgery the same day if you wanted to. Okay.
You can do that with also template guided, because I have one of those Sprint Ray printers in my office. So we can plan, and I have a technician, but if you don't have a technician, you've got to stop and print it. But I can have the patient and scan them, plan it, and print it, and then do it the same day as well. Yeah. So you can do it both ways, but you do have to be kind of a little bit, ready for that type of technology.
Yeah,
but I see dentists going that way. I see dentists are going to be everyone will have a scanner, and I've lectured about scanners all across the States, and most places I went, people had about 5 to 10% of the scanners when I was there. And that number is going to jump up. And with new scanners that are coming out, we have 4 different scanners in our office now. And we're fighting over the scanners. Like it's the way of the future.
Yeah. Just reduces error, increases predictability. And like you said this, so we were talking, I mean, when you're ready for this, you're talking about populating charts. You can actually have the bone all mapped out. Talk a little bit more about that. Like its capabilities are tremendous.
The capabilities are interesting because I'm speaking with friends, from like Dente, like they're into AI. So AI, for those that really haven't heard of it, is artificial intelligence. And for dentistry, it's about the diagnosis, also about charting. So for instance, patient comes in, you have your chart open and the chart is empty. Often I'll see cases that, where people will send the chart notes over and the patient's not even charted. So instead, you might take a pan x-ray or a CBCT. And when you take that x-ray, The computer will then take it and chart your missing teeth. It'll chart your fillings. It'll chart your crowns. It'll chart everything for you in seconds. So then you can spend the time talking to the patient. It'll also go in and chart your bone levels. So you can go in and say, okay, the patient has periodontal disease. So instead of probing everyone, now you're going to still probably probe, and we'll see different ways. So what you can then do is take the digital chart of the x-ray, blend it with the intraoral scan, and you'll get to know what the probing depths are. You get to know what the attachment is. So this is really getting advanced. And so the population of charts is one thing. Then there's also diagnosis. So if you're doing an implant, I had a case I was using the AI model on an implant case, and there was a spot that had an infection on the end of the root. And the computer went in and said, there's a 95% chance that you have a periapical lesion here. And then it's up to the dentist then to say, okay, yes, it is, or no, it isn't. So the dentist makes the final decision, but that pre-diagnostic kind of capability is unbelievable, where we're going with this. So where I see scanners going in the future, and even x-rays, is going to non-ionizing radiation. So if you see parents come in, they say, I don't want little Johnny to have an x-ray. And then you can take out a light and shine the light through the teeth and find the caries instead. Those are things that are going to be big in the future. So I see it going that a scanner is probably going to look more like what a tray looks like when you're taking an impression with an alginate. So you take the tray, stick it in the mouth, and the scan happens in seconds, and you get the whole arch at one time. And then you take the tray and put it in the top and take the scan, and it's also looking for caries at the same time, charting your chart, filling it all in, and then you sit down with the patient and wow the heck out of them. Because that's what I'm doing, is sitting in, I'm using some software called DTX. We take everything and put it all in the software and then show the patient what's going on in the mouth.
Right.
And
Now I have so many questions for you on this, because I've seen your stuff. Now one of the things, and then I'm going to totally screw this up, but you're going to add clarity to it. When I've been at Symposium watching the treatment planning championships, I have come to understand, and I'm going to totally screw this up, but you guys, there's only one true diagnosis, but there's multiple treatment plans. If I'm a young dentist watching this and you talk about guided surgery, how important is the diagnosis in getting that right? Because you can see the margin of error is bad on the first try. It's going to be even bigger on the second step. So tie that into, you have a lot of experience with this. How important is that in this component?
For me, I think it's critical. When I sit down with a patient and they come in and they have, for instance, multiple missing teeth and wear and a whole bunch of things going on, it's often, where do you start? Who do you kind of call? Who's on your team? Are you going to be using orthodontics to fix this? Are you going in to talk to oral surgeons? Are you going into, perio? And so with all these techniques, there's skills. And so the reason why a specialist is a specialist, because they have a higher level of skill in certain areas. And so with this technology, it gets us to look closer. And so even general dentists who are doing a lot of different types of work, then it gets you to look closer. And so that's what this is all about, because I can look at a case and not see what's going on, and then have that, aha, I understand now. I understand when I look at a Malin patty in the back of the throat and it's a 4, then maybe the etiology of this case is about, airways, and start to think about those type of things. And so as we become more educated and learn from each other, I see these things happening, and then we can help the patient to visualize that. Because I can take the diagnosis and say, okay, you have this diagnosis, but I can have a differential diagnosis as well and say, well, there could also be this, but then we can also take it over here, and the treatment could be this, or we could go this way. And then, so it really takes it, so it's into different levels of understanding. And I find often patients will come in for a second opinion, and when they leave, they go, okay, I understand, because they visualize. You think about me reading a book or me watching the movie. I'm a movie guy, so I'd rather watch video. I'd rather see that. And unfortunately, that's just the way I am. But patients are very visual. So whether you're taking photos and showing them other cases you do, it's really important to them understanding, because it's not that difficult most times. Most times there's a pattern that starts to follow through. And when you see a posterior bite collapse, what are you going to do about that? When you see anterior wear, what are you going to do about that? Or airway troubles, are you going to correct that? Are you going to treat that? And so you start to go through, but you need to kind of check the boxes somehow and make this kind of happen. And so that's what I find even Seattle Study Club does so well, because I'll say one thing and then all of a sudden I'll have my periodontist on our team. She'll go, well, what have you thought about this? And it's always very nice. It's always like very kind of like cohesive.
Right.
And so you say, have you thought about doing it this way? And then you go, oh, that's really interesting. And so that's what, kind of digital does for us, because it puts it up on the screen and we can see what's going on. And so you go through a series of, your perio exam, you go through getting your full mouth series, you get your pen, you get your SEP, you go through a systematic approach. But these are all visual things. And now we're able to bring them together into a program to let the patient see that. And you're really doing, what I'm doing is doing what I kind of do when I go on the road, is doing a presentation but it's to one person, the patient. I may take that and say, listen, do you mind if I use this case? Because this is really interesting, because I can treat you different ways. Yes, you have advanced bone loss and you have a problem, but here's two different ways. And then they say, well, why are you doing it that way? And then you can get into that why thing again.
Yeah. The visual, I totally agree with you on the visual. It's so funny now, even my kids are like, they'll be citing, and I've seen it in dentistry, people are citing YouTube videos. Like so I saw it. Where did you see that? Well, I saw a YouTube video. It's so funny. It's if they saw something visually in a video, they treat it as truth. And it just kind of like jumps over literature sometimes, which I could not agree with you more. Now, another thing, you and I were chatting about this. Okay. Speak to the future of this. You said, now this will never alleviate the need of a dentist, because people always, that's one of those interesting conversations. Well, what happens? Will we even need dentists in the future? The dentist is always going to have to think, just like a self-driving car isn't just, it's different. But tell them what you said to me before getting on. You're always going to need a great thinker, a great
You do need a great person to understand what the computer is telling you, because dentistry is something that happens with the hands, right? So I don't think we're ever going to see drive-through dentistry. So you drive your car up, stick your head in the window, and then have your dentistry done. So in order for that to happen, you need to have a person that's going to implement the plan. So therefore, AI probably has its limitations. Maybe I'm wrong, and you can go and have the filling done or have the filling prevented. But so far, people still get cavities and they still have problems with bite collapses and all kinds of different things that they want treatment. They want to know that you are going to be able to make them better. And it makes me so proud when they come in and they have been many years out and they're doing well. But that's what it's about. There's an emotional part to dentistry, and the emotional part I don't think will ever be captured by AI. Maybe I'm wrong, and then you're going to have this amazing computer, but the kit car or whatever it was, driving around, people have been killed in cars so far. I'm going to be a little bit, careful, but I'm going to be joining in because I think the technology's there. Because, you're going around in your car. Just think about the technology of cars. Think about what's in your iPhone that's now in your basement, like the fax machine, the video camera, the this, the that, the video, the recorders. Things have changed and people know that. That's not a real big topic, but what I do see is what you're saying is that dentistry still has to have someone to say, okay, if that's a problem, what are we going to do about that? Who are we going to send it to? And that's going to take a number of years if you're ever going to rule out the dentist. I don't think that can happen, but maybe I'm naive. I don't know. But
yeah. No, I get in the same conversation with my sister, who's a cardiac nurse, and she's like, no matter how fast or far this technology goes, you need the surgeon guiding everything, no matter how good it gets, So I think that's critically important. Now, I also want to ask you, you're on the front of this, you're a KOL, you get to see the inside of all this stuff. And this is anybody's best guess. But if I'm a 32-year-old dentist watching this, Scott, what can I expect in the next 3 decades? What's on the horizon, and why is this, such an important topic?
I think healthy diagnosis is on the horizon. like getting healthy things, like for instance, the CBCT. The CBCT is an awesome tool, but is there something that we can use maybe that's a radio wave or some other way of seeing through the jawbone that we haven't thought about? And so that we don't cause like ionizing radiation, we just have to be careful with that. So for instance, if I have every patient coming through my practice and everyone gets a scan, that needs to be healthy, so that, we have a CBCT and we use it very reserved and we do our planning and it's very low radiation. And if we can lower the radiation even more, fantastic. If we can say, okay, we only need, for instance, if we're doing endodontics, we often will do a CBCT of the tooth so we can see the single tooth. And so those things, using as little radiation as possible, I think that's going to be big for us. I think also how we get things done faster and better. So I see dental assistants as not being trained properly right now for where dentistry is. I have to retrain my dental assistants, even dental technicians. They're learning on the job, and that's not right. We need to train people about what the future is now. And so in terms of intraoral scanners and how this all blends together and periapical x-rays and seeing where that's all going, I think that the future is going to be how you consolidate that and make it, people are very health conscious. I think that's a big deal. People want implants. We need to educate people about why. And often I'm doing that and spending time with them. So I think that's going to be, like, we need to become better presenters, better, like the more we can do, like, KOL means key opinion leader. It just means we have an opinion with a company, and you have to be somewhat careful because you get, loving these companies. And so, there's a bias that starts to happen, and you have to tell the bias when you're out there, but you're doing a lecture, and I don't mind sharing my biases, but at the same time, I'm a dentist and I'm for the patient. And so, the future of dentistry, way back, I said the iPhone is going to be huge, and that's exactly what's going on. The iPhone is going to be even more involved in dentistry. You're going to be, doing everything from, EKGs to health data that has some influence on what you do now. And for instance, maybe we don't do the surgery because there's some other issue that's more important that you need to send it off to a cardiologist. And so the screening of COVID, all that stuff's going to be done with iPhones in my mind. And even, saying that, if I had COVID, God bless I don't, but then if my iPhone comes in contact with someone else's, there's just going to be so many things that are kind of come through Androids and iPhones that, that we'll be using them every day. So our softwares need to be video compatible. None of them are. We don't have video file storage in, the AI stuff. And same with, in most programs, there's not a place to store video. So that is going to be huge. And so because people, if you're getting 35 frames a second photos to make a video, then you're going to be using that to show what's going on, document, talk, and doing a shoot inside the patient's mouth. And whether you're plugging something into your camera, like the things I was talking about, a video tray that goes inside, or something that goes across, you're going to start to see some things different. And we'll start maybe using radio waves to ultraviolet waves to a whole bunch of different things that we haven't even thought about.
Yeah. Now go back to something you said a little bit before, because you said not only patients love the technology, but your team loves the technology. And earlier you said your team does a lot of this. Now, some dentists are like, no, my team can't do it. Can you talk about the team members taking hold of this, and then just the efficiency on the time aspect? And it also changes their lives. They become part of the restorative process. Like, you've made that transformation in your team. How important is it to get your team involved?
The team is really critical, because what happens is they go in, they learn the basic stuff, and they're learning how to place DI-cal in the bottom of an amalgam restoration to, doing resins. And so those are all very valuable skills, things that they need to do. But the reality is that dentists are going digital. And so it's really important for our teams to be involved with that. So for instance, if I'm going to do an impression for an implant crown, I'm not going to do it now a single crown with polyether or something like that. When I'm doing a bridge, yes, because the technology is not there yet. So I use the polyethers. But when I'm doing the single, I'm doing an implant crown. So what happens is the staff person, my dental assistant, will come in and scan the whole patient's mouth. I'll come in and erase one part of it, and I'll do the detail that needs to be done by the dentist. And then scan the scan post and scan body, and do the small little things that need to be done that are so exact. Take the bite, if I need to take the bite, and send it off to the lab. The beauty of that is that there's no COVID virus that I know that's traveling over the internet. And so you end up having a very sterile data file that goes off to the lab. The lab creates a new file, creates your crown, and then we need to clean those before they come back to the dental office. That's a real problem, I think, in dentistry today, is that the things coming back from the lab can't just be, steam cleaned. We need to use plasma cleaners, and we need to do things. So either disinfect them with chlorhexidine, a whole bunch of different things. So the process is getting better, but the more digital we can do it, the better. Now, will it be in the dental office? Probably, but then you need more team members. We did CERAC for quite a while. Now I have a lab technician in the office, and I love it. I think it's lab technicians, they help so much to how the process happens to beautify. Not to say that the other doesn't work well, it works incredible, but it's just what you want to do in your office. So having your team be able to do more. I run all the time, pretty much 2 assistants, and they can't keep up with what we're doing. And so 2 assistants are full out, and one's going, I'm going to do a scan, I'm doing this, and they know exactly what they're going to do, because I'll say, patient comes in, we're going to have a implant workup. Well, implant workup is this. We're going to do it all in 4 prosthetics. It's 5 steps. We're doing step 1 to 2 today because the patient's coming 3 hours away. So we have everything so that the team understands what the process is. And guess what? They love their job because they're not just being told what to do. They're kind of doing what they know is part of the system. It's all about systems. Yeah. And so computers give us systems. And if I can give my dental hygienist, their team, to have a way to do probing better, then more probing. We need probing on every patient. And so if they're below a certain age, like we're below 20, we're not necessarily probing, but above 20, everyone has probing, and we need to be able to compare that and say, what did it look like here? How much recession happened? Push a button and you can see it. You can see the new recession happening. So you can see with virtual reality models what we can do to improve it. So you can say, if I send you to the periodontist, they can do a tunnel graft and make it look like this and show them. So it's going to be fantastic, the future. And I think that we're only scratching the surface. And so the AI that's coming that I've seen is incredible. It's really something.
This is a loaded question, and I love asking it, is that, have you ever remembered a more fun time or exciting time to be a dentist?
No, and you know what? I put something actually that how I believe it was a YouTube that I watched. Actually, it was TED Talks, and I put it into my own YouTube video style. So it's called Stress in Dentistry. And there's a graph, and the graph was kind of like how your skills are. And then the other side was the skills versus the difficulty of treatment. And if you have good skills and a difficult treatment comes in, that is your most rewarding case. So if I have a full mouth of really worn down teeth and I know what to do and do it, and the patient loves it, or I do it all in 4 and do that, then what happens is that is the most rewarding dentistry I can have. And even if I don't get paid for it, I just love it, and sometimes you do these cases where you don't do that, and so you just don't charge them. And those type of cases, if you can make someone emotionally change for the rest of their life, that's the type of dentistry. So really difficult case and really high skill, you're going to feel rewarded. And I think that's what you're talking about. So these digital tools are helping me do those cases.
Yeah. You and I are going to do it. I'm voluntolding you for this. We're going to do another episode on your XY axis graph, because I love that stuff. And you're going to see Scott just has a lot to give on these side of things. I always love to end in a couple of things, and I know we only have for so much time. And one of them was, he has a hard time with 2 dental assistants keeping up with him, even with a bad knee. So like you're moving fast, like, and getting a lot done. So that says a lot. Now I want you to speak to just, I always love to end anything we do, or as we close, just a good word. Like if I'm a young dentist, give me some thoughts to think about, because I might be stressed about the pandemic or being a young dentist and trying to juggle all this. You've seen it all, Scott. What would you tell a younger dentist or a dentist coming out of school about the future of dentistry?
I would say that you need to latch on to mentors. And so that's what Seattle Study Club is about, getting a mentor. And to be a mentor, or to mentor someone else, or to get mentored yourself, realize that's going to happen. When I have an associate in, I take the time to talk to them and find out what they can help me with too. So what did they learn at school? How did that work? So realize you have skills that we want, and we have skills that you want. And so sometimes don't just think that you get out and you've got your black belt and you need to stop there. You may have think you have a black belt, you may have a yellow belt, but the reality is you need to keep growing. And the learning is not just about dentistry, it's about life. It's about how you relate to other people, how you talk to them, how you use their name, how you make them feel, because people will remember how you make them feel over what you did. And that's so important. I remember someone telling me, I think my dad told me that, but it goes back to someone else, I'm sure, but they remember how you feel. So dentistry is a real touchy-feely type of thing. So you need to learn the skills that will enable you to see what you need to do. Because number one, we're very tunnel vision when we come into dental school. And when you get out of dental school, you get the tunnel vision. You need to look bigger. That's what these things like Seattle Study Club, get involved with that early, whether it's that or Dawson or whatever type of club you do, John Boyce, get into a club and find out what's in your neighborhood, and get into a club and listen and start listening. And when you listen, you learn. And that's what I found out. Sometimes I just sit back, and when I'm teaching at a Seattle Study Club, for instance, I'll put up a case and I'll purposely say, okay, this is the case that's coming up next week in my office. And I'll listen to all these specialists and people talking about it. I go, okay. And they go, what did you do? I said, oh, I haven't done it yet, but thanks for the treatment plan.
Hey, thanks for your help. Yeah.
And so, I love dentistry. I think that you need to reach out though. And there's some younger people that I've met through Kirk that I think are fantastic. And, it's just amazing. And then there's other people that have so much skill. And I go, okay, that presentation put everything in a nutshell that I really want to go back and look at that. And for instance, Carl Misch, who was a big deal in my life, I just found the notes that I had typed up from his lecture, and I typed every word that he did, studied them, learned them, and understood it, so that when I went back and would understand and see the patient, and then grew on that and start to get to the best people in the world, learn what they're doing, and then also find a mentor. Because dentistry is a lifelong, that's why they call it practicing. It's a lifelong practice. And if you think you're finished, you're not finished really. You need to keep learning, because each case is so similar but also different.
Yeah, I know you well enough. You're just getting started. It's so exciting. And so I'll say this again. If you haven't had Scott speak to your study club, you got to have him. Now, I want you to give us a little sneak peek, because if you're listening to this or watching this, I'm going to encourage you just to show up for Symposium. Scott, tell us what you're going to be doing during Symposium. Like, you're going to see some great stuff. What are you going to be teaching during the Seattle Study Club Symposium in January?
I'll be teaching, I'm kind of involved with this software called DTX. And DTX allows me to plan dental implants with excellent, precision. And so what I'm going to do is then show exactly how you do it. And so putting things together and understanding what an STL file is, and going through the building blocks and understanding what DICOM files are, putting it all together and saying, okay, this is how you do it. We'll go into the why you do it, but a little bit about how you do it. And I think how is what gets people to kind of go forward. But that's what the topic will be about, and it will be kind of very visual. So my presentations are very video oriented. I don't know, I'm sure people spend as much time as I do, but I spend a lot of time on my presentations.
Yeah.
And it almost drives my wife crazy because I have a list that doesn't get done sometimes. But the it'll be talking about that, and I'll be looking at a lot of presentations there as well. I'm going to be, an enthusiastic student that I don't want to miss anything. I want to see it all. So
Yeah.
I would say get out and get to that symposium. It's going to be hopefully a once in a lifetime way that they do it, because you do want to get to the symposiums in person at some point.
Yeah.
And when I did that, the first one that I went to, I still remember, Kirk, I was really kind of like, okay, what is all this? There's all these people around and doing all this stuff. And I go, I feel like a small potato here. And then all of a sudden, I just felt like there's an emotional connection that happens with a number of people. And you end up being part of a very big cultural group that has advanced dentistry's back. And so you have people saying, okay, yeah, I'm a GP, but oral surgeons are coming up and saying, look at this. This is the way that it could go. Look at that. Look at this. And so it's just so, like, it's amazing how the group of people get together. And then what they'll do is bring in the top people to talk about what they talk about.
Yeah.
Some amazing speakers there.
Yeah, I totally agree with you. I couldn't live without it. Number one, you see some amazing speakers, but the same thing, you don't feel inadequate. You don't feel isolated. You go and talk to them at the bar and they're just normal people and they're all givers. It's pretty fun. And those are often my favorite conversations, just on the side, getting to see people, and you look forward to it.
I always say I learned more on the back of a napkin sometimes than most courses, right? Because people will sit there and draw something out, and those meetings have those gems. You don't want to miss something like that. Yeah. So it's not like your regular Zoom or your regular kind of course. It's like what you do at Act Dental. It's about quality oriented. It's not some company that's selling you something. It's about quality oriented dentistry to get you to the next level. And it's about you as the person, as the dentist, not necessarily about everything else, but you and how you treat your patient. Because I remember a very good mentor of mine when I was in the first day of dental school. I was sitting in the course, and Dr. Precious, he went up to the front. He said, now, I think you guys have come from an area that it's all about getting good marks. Right? And we were all going, yeah, that's why you had to get there. He said, I want you to forget about your marks. He goes, so I want you to, when you're treating a patient and sitting opposite them, I want you to have the most skills that you could possibly have. And so I want you to focus on getting the information, not getting a good mark. Get the information so you feel confident in treating that patient when they're in front of you. And I think that was the best advice that someone gave me as a new dentist, because I just sat and thought, wow, that's really profound. And I still remember he showed a person that was about 30 years old, showed a really good looking guy on the screen. And then he showed after that they had missed cancer in the face. They didn't see it on the x-ray. And he lost half of his face. He was going, if you had followed what I'm saying, this patient would be living a different quality of life.
Right.
And then he walked out, and it was like shivers went up my spine. And I said, okay, this guy, I like what he was saying.
Yeah. Always be curious, never stop learning.
No.
You just keep asking questions and learn as much as you can before you do. I love it, buddy. I am so grateful for every minute. And when you said the word quality, that clearly describes you as a person, all that you stand for, what you teach, everything. So I'm so pumped, and I want to have you back again and again and again. Talk about whatever you want to talk about. Heck, we're going to talk about football the next time we get you back, or anything. I would love to know how you get so much done in a day. That would be a great podcast. But here, just for the benefit, there's going to be people listening on iTunes or Google Play. Scott, they might not be able to see this. Like, where can we learn more about you? Can you direct us? I want you, if you're listening, check out his YouTube page. So tell us how to get to the YouTube page. Where's that?
So YouTube, I have probably 3.5 million views now, and it's one of the biggest dental sites. So it's going quite well. People learn things there. It's about sharing things. you go to YouTube and just type in Scott Maclean, Maclean. If you go to my Instagram, I'm putting videos up, not every day, but a lot of times I'm going to put up one in the next few minutes. So it's always about some little topic that's maybe 1 to 5 minutes. My videos on YouTube are about 10 minutes or less. And then on www.drscottmaclean.com. So if you type in Scott Maclean, I kind of own Scott Maclean around the world right now because of Google and how YouTube works. Because it's helped me because it just gives me the ability to push forward. I talk a little bit about also Instagram and how you use that to track patients and how you can do marketing through Instagram and how you can't. I have a very successful son that's generated way more money than I have in my life already. He's like 29 years old and he shared a lot of stuff with me. And so I share that to dentists as well.
Wow. Let me go back to that because I want you to tell the story. So guys, check that out. The YouTube page, his Instagram. Now your son it's brilliant. Now it's not just about money. He did something really, really special. You guys had a very unfortunate incident happen in your province and he really stepped up and it's powerful. Can you just tell that story, what he did for your province?
Well, what Alex did was a number of years ago, 2013, he started the company. It was all about what we were talking to him about is he was trying to generate some emotion with t-shirts and things like that. So he made this t-shirt that was all about home. So last year, or during the year, right during COVID actually, there was a denturist who went around and shot and killed, and I can't remember the exact number, so I don't want to say the wrong number, but many people. And he went around shooting people. He dressed as a police officer and then knock on the door and go up and shoot them. And so Alex felt so compelled about this that he made a special shirt that said East Coast Strong. This thing is called East Coast Lifestyle. And with this East Coast shirt, he raised money. So he ended up and Alex, this is the kind of boy he is. He's 29 now. He didn't go to media and say, listen, look at me or anything like that. He made a small Instagram saying, here, Red Cross, give this money to these people. So he gave them $300,000, the money that he raised through that. And so I guess it's not about money for Alex. He looks like he did all the time when he grew up. He's a very giving, compassionate person and very proud of him. But he gave this money and didn't ask for any kind of publicity whatsoever. Yeah. He gives money to like the homeless, to people who are battered housewives. And he looks after, he's been very gifted and very fortunate and very lucky and has worked hard and done very well. But at the same time, he gives back and I'm so proud of that. He's amazing that way.
You should be proud of your son. Heck, I'm proud of him. He's not even my son. So that's awesome. What a great guy. Great guy. Cool.
And it's certainly not about money for him. But that's just one I would look at and go, what the heck? He's killing it. And anyway, I gave him $800, Kirk, to start the company. I made a mistake because I should have got shares instead of.
I know. Heck, you should. I'd buy a couple shares. I told you the story. Like when I first got on Instagram, I had one follower. It was my daughter, and then she unfollowed me. So I could use your son's help. I have no idea what I'm doing, but oh man, it's so much fun. If you want to see some great stuff, just check out Scott's stuff. Join us at Symposium. I'll be there, and we'll just have a great time. Scott, I can't thank you enough, buddy. Thanks for being on.
Really great to see you. And thanks for what you do to the community or for the community, because you're an emotional person that, I really gravitate to you. I think you're an amazing kind of leader, an amazing type of person to be mentoring other people like you're doing. And I hope that people see that you are doing this for us and what you did through COVID and what you're doing, forthright. And your business can help a lot of different people. And I hope that love comes back to you some way, because I think that you're certainly putting out 150% to our community. And I'd like to thank you, because you certainly helped me and my brain get through that, those dark times with COVID in March. Yeah. And it gave me a reason to get up and pretend I was going to work and get online with you and go shoulder to shoulder and laugh and learn and understand. And there's still things that I'm doing my composite resins way better because of different people showing me tools and techniques. I'm doing different things better. And I think that's the thing is that, I'd like to thank you for that.
Well, it's my pleasure, buddy. And we're all in this together. And it's an awesome, blessing. Dentistry is just a noble profession. And I was panicking like anyone, and I didn't have anything to bring to the table other than great educators, and just keep education brought us together. It'll keep us together, and it'll keep making us all better. And so it's a great bond we all share. It's fun stuff. So good stuff, buddy. Well, thank you so much. I appreciate you. Stick around while we say goodbye to everybody else here. So thank you guys for watching. Thanks for tuning in. Check out Scott's pages and visit back. I'm going to have him back again and again. So we'll see you guys at Symposium. And until we see you next time, keep watching the Best Practices Show. You guys enjoy the rest of your day.